Hello and welcome. I'm Taylor Clark, the Graduate Programs Admissions Recruiter Advisor for the USF Health Taneja College of Pharmacy. I'm here to tell you about the Masters of Science in Pharmaceutical Nanotechnology program. It's a graduate degree that we're extremely proud of in the Taneja College of Pharmacy because of the unique opportunities that it grants our students and the edge that it gives them once they start entering the healthcare field. We're very excited that you've joined us for this presentation. And without further ado, let's get started. We'll start with a quick overview of what this presentation will entail. First, I'll give you an overview of USF's Taneja College of Pharmacy as a whole. Then we'll get into what nanotechnology is and its uses and applications within pharmacy. After that, we'll talk about the jobs that you can get with a career in nanotechnology. After that, we're going to talk about the Master's in Science of Pharmaceutical Nanotechnology degree and more specifically the admissions requirements and how you apply. We also offer some graduate certificates that I'll go over as well. Let's get into our overview of the USF Taneja College of Pharmacy. The college was established in 2009. We admitted our first class for the Doctorate of Pharmacy degree in 2011. They became our first graduating class in 2015. And shortly after they got their degrees, we decided that it was time to expand our options for opportunities to give to the students. And that's when the Master's of Science in Pharmaceutical Nanotechnology program was established. After that, we expanded further, offering graduate certificates and turning our MSPN degree into a concurrent degree with the PharmD program. And we absolutely cannot talk about the overview of the Taneja College of Pharmacy without talking about the man on the left of your screen. That's Dr. Kevin Sneed. He's our dean. And he's actually our founding dean, which means he's been here since the beginning and has had a hands-on approach in every aspect of the vision of the USF Taneja College of Pharmacy since the beginning. He also is a practicing dean, which means 2 days out of the week, he's actually still seeing patients on top of all his other responsibilities here at the school. I also need to tell you about Dr. Shyam Mohapatra. He's the Associate Dean of Graduate Programs for the Taneja College of Pharmacy and the visionary leader behind the Pharmaceutical Nanotechnology program. He believes very strongly in what this program offers to students. I want to show you this video to give you more about his background and more about the nanotechnology industry as a whole in this program.
My name is Sam Mahopatra. My goal in life is to really apply the biomedical nanotechnologies for the improved diagnosis and treatment of human diseases. When it comes to my background, I think of India and I think of rural India. My grandmother played a very, very important role because in a family of 4 or 5, I was the sickest kid. But she always kept telling me, don't give up, don't give up. She is the one who also planted in me the idea that you got to, when you grow up, you try to find ways to help others. One of the big problems with the drugs that we currently have, unfortunately, most of these drugs are what we call insoluble. So it is not being available to the cells that needs to be killed or treated with. So they are not doing their job because we are not getting enough drug in the right way to the site of interest. And this is where nanoparticle technology has done wonders. It actually can make insoluble drugs to soluble. It can take the drug to the right place of interest in the body. The investigator decides what he wants to treat, how he wants to treat it, how he can modify. So each nanoparticle you can build based on the needs. USF is creating the ecosystem that flourishes innovation. And I think everybody wants to work together, trying to make it happen. And so if an idea, this is the place to make it happen. In the future, our goal is really to take these technologies, which have technology of identifying right drugs for the right patients, and the technology of creating new drugs that will go after cancer stem cells so that one can cure cancer. I am Sam Mahopatra. I am a bull.
Now I'm going to tell you more about the Taneja College of Pharmacy in terms of where it lies within USF Health. So we are one of 7 colleges and schools within USF Health. So that is made up of us, the Taneja College of Pharmacy, the College of Nursing, the Morsani College of Medicine, the Doctors of USF Health, the School of Physical Therapy and Rehab Sciences, the School of Biomedical Sciences, and the College of Public Health. One of the biggest benefits of the MSPN program is that our faculty are interdisciplinary, which means they are involved with other colleges within USF Health. So our students are always being exposed to different perspectives, ways of thought, and not to mention having network opportunities across different healthcare fields within USF Health. Not to mention, many of our faculty are still working in the healthcare industry, and USF Health has a number of partnerships throughout the community and the healthcare industry. So, through that, students are exposed to a number of opportunities through the program, through the people they meet and the people they learn from. Because there's so many different working pieces and different experiences and perspectives coming from all these different areas, we encourage our students to embrace that sense of collaboration. All of our departments are always working together to push research initiatives, to get more grants for funding for more research and projects. And we encourage our students to come up with ideas of their own and be a part of all this collaboration. So now we'll get into the details of more what nanotechnology is and how it relates to the pharmacy industry and pharmaceutical practices. So let's give you an idea of what nanotechnology is if you don't already know. Nanotechnology is the study of the small, the smaller than small, submicroscopic. If you take one red blood cell, that is already 5 to 7,000 nanometers in diameter. That gives you an idea of the size that we're talking about, and it is that size that allows this field of study to be so unique and offer solutions to problems that have never been thought of before. Nanotechnology comes up in all sorts of areas. In the pharmacy world, it's used for things like targeted drug delivery, using nanoparticles to bind cancer cells and minimize the side effects, meaning they can take radiation and chemotherapy drugs and make them target tumors so that patients feel less of the side effects from the treatment that they're getting. Likewise, they can put nanosilver particles infused in bandages to speed up the healing of wounds, or nanoparticles that glow in the presence of cancer cells so that doctors can find where the cancer is faster and improve the outcomes for their patients. Nanotechnology is still relatively new in the grand scheme of things as far as field of studies and science. It was presented as a concept in the late 1950s and it was met with a Nobel Prize at the time. In terms of nanomedicine, the first FDA approved nanomedicine is still only about 30 years old. The drug was called Doxil. It's an anti-cancer medication and it's still being used today. But nowadays, nanotechnology is everywhere. It's in our phones, our computers, our smartwatches. Some companies use it to make clothes block more UV rays. Maybe they make clothes smell better using nanotechnology. And in the field of medicine, it's being used for all sorts of different applications, like they are repairing damaged hearts with nanotube fibers. I was just looking around at nanotechnology headlines the other day, and I saw research that was so potentially world changing. Basically, the problem they're trying to solve is all of the organs that go bad during transplant, from getting them from the donor to the person intended to receive the organ. Essentially, they're studying taking an organ and putting it in a solution of nanoparticles, magnetic nanoparticles, and then flash freezing the organ from there. Once the organ is frozen, they can put it in some special equipment to reheat it to a safe temperature. And because of the magnetic nanoparticles throughout the organ, it's able to reheat it in a way that is even and it's safe to put into a human body. And once perfected, just think about the number of lives something like that could save. Right now, you're probably wondering what the workforce for the nanotechnology industry looks like and how getting an MSPN degree can help you break into it. It's an industry worth breaking into because it is growing very fast and companies are investing more and more money to it all the time. There are currently more than 2,200 companies in the nanotechnology industry in the United States alone, and in 2013, the nanomedicine market was projected to be about $80 billion. That was about 10 years ago. This year, it's projected to be about $140 billion. That should show you how seriously companies are taking nanomedicine research right now. Now, in terms of getting the MSPN degree and why it's a good idea, flat out, people who have STEM degrees get hired more and they get higher salaries when they're in the workforce. There's faster growth in science and engineering employment relative to the overall employment. That's about 13% for STEM majors and 7% for overall employment. And that's expected to continue for the next 2 years. When it comes to people who have graduated from the MSPN program and received the degree, we are happy to report that we have a 100% placement rate, meaning that everyone who gets an MSPN degree ends up continuing on their either academic journey or professional journey. I'll give you a breakdown of those numbers in the pie chart. 12% of our students tend to go to professional school, 16 go off to a PhD program, and 72% enter the workforce shortly after graduating from the MSPN program. And a lot of that is due to the networking opportunities and other ways you can get experience in the program. Without further ado, let's get into the different ways that you can get an MSPN degree at USF. This is actually a point about the program that we are extremely proud of again, because it shows all the different ways that you can achieve the MSPN degree and the ways that students can customize their learning experience so that they can learn more about exactly what they want to learn about. We'll talk more about how students can customize as we go through the rest of the presentation, but for now, let's go through the different options really fast. First, we'll talk about nanomedicine. Nanomedicine is the only specialization on these academic options. All of the other ones on your screen, those are all concentrations. So nanomedicine is special for a few reasons. Number one, it is the only option that can be completed completely online. Nanomedicine is also the only option that can be completed in as little as 1 year. And nanomedicine is actually the most customizable in terms of the different electives that you can take. This is the program that we offer to our pharmacy students, the ones getting a PharmD degree, the most because it's more manageable with the rest of the classes that they would have to take for their pharmacy degree. But we find that this is also a very preferable program for students who are on their way to med school, who are on their way to another graduate program, and things like that. Moving on to entrepreneurship in pharmacy and pharmaceutics. This one is more tailored to learn about the business side of pharmacy. This is a special concentration in terms that it is the only one where you are required to get an internship, and we'll talk more about that later, but this one is more suited for students who are trying to get into the business and maybe trying to start their own pharmacy one day. We have two concentrations that require students to do their own original research and present a thesis about that research at the end of the course. Those are translational and clinical research and drug discovery, delivery, development, and manufacturing. We call that one D4M for short. Both of those concentrations require students, like I said, to get into a lab, start researching their own ideas, and in general, learn more about that part of the industry. Grant writing to secure funding, writing lab reports so that you can present your ideas to the rest of the field. The big differences here are the classwork that you're required to take in each one, which we'll talk more about in a little bit. Next, we have our biomedical engineering concentration, which is of course more tuned to students with an engineering background. However, an engineering bachelor's degree is by no means a requirement for this concentration. However, this is more tuned for students who are suited to maybe using biomedical devices at the nanoscale and learning more about those applications. Last, but certainly not least, is our concentration on complementary and integrative pharmacy, which is our newest concentration right now. What's unique about this concentration is that it focuses more on natural and alternative medicines. It uses herbal medications, nutritions, and just ingredients from the natural world to bring them into the pharmaceutical industry to create new solutions and new drugs to help out with old problems and use a more natural approach. Now that we've gone through all of these topics, let's dive in and focus more on each one. Looking closer at our academic options, we will start with our only specialization, which is nanomedicine. And again, nanomedicine is the only one of these options that can be completed fully online, which makes it our most flexible option for that reason. And also, as we're going through these concentrations, pay close attention to the number of electives that each concentration allows you to take. Nanomedicine has the most elective coursework available to it and is therefore the most customizable to what students want to learn about, albeit the other concentrations focus more in on their specific areas of focus. The other element of the nanomedicine course, like several other options, is our graduate capstone course. Essentially, what that is a class where the big assignment is to create a portfolio about yourself. That's all of your experiences, what you know how to do, your education levels, your goals, accomplishments, papers you may have published, research you've done, all sorts of things like that, all wrapped up into one package, which turns extremely beneficial to students because when they finish the nanomedicine concentration or another concentration with that capstone course, they then have a complete portfolio to give to professional school, PhD programs, or future employers. So it helps them move on faster in their academic and professional careers. Now we'll move on to entrepreneurship in pharmacy and pharmaceutics. And like the name suggests, this concentration is geared towards students who see themselves as a healthcare provider and also a business person as well, and want to get more exposed to that side of the pharmaceutical industry and the nanotechnology industry. We'll see again, the students will be taking the same 10 core credit courses as they do in all the concentrations. And entrepreneurship in pharmacy only has 10 credit elective courses, so pay attention to that because this one is less customizable. However, the interesting and most unique part about this concentration is that you are required to get an internship before graduating, as well as doing your graduate capstone course. See all these brands on the screen in front of you? Those are all partners with USF Health and the Taneja College of Pharmacy. Therefore, getting that internship is a much easier task between all of our partnerships with neighboring companies, as well as connections within our multidisciplinary faculty. Now let's talk about our first of two concentrations that require students to do their own original research. This is translational and clinical research. Here, students will learn the ins and outs of being in a lab, including writing lab reports and learning lab procedures. They will also be tasked with doing their own original research and presenting that work in a thesis that they'll defend. The thesis and research requirement takes 10 credit hours on top of the 10 core credit hours, which, as you can see, leads to less choices in elective hours. For this concentration, it's 12 hours. Students can think of this concentration as a surefire way to get in a lab and start researching to improve the healthcare field. Now, the second concentration where students are required to do research and defend a thesis. This is drug discovery, delivery, development, and manufacturing, but we call it D4M for short. D4M, like translational and clinical research, requires those 10 hours of research and thesis work. The key difference between the two concentrations is that D4M requires 6 more credit hours in that area of drug discovery, delivery, development, and manufacturing. Therefore, this is one of the least customizable concentrations in the program with only 6 elective credit hours. However, I will say that historically, D4M is the most popular concentration that students pursue. Next, we'll talk about our biomedical engineering concentration, which again, you don't need to have an engineering background to pursue. However, many of our students who do pick up this concentration do have that kind of interest. Pay attention once again to the number of elective coursework you're allowed to take. This is our least customizable option in concentrations. Notice you have to take 15 hours in biomedical engineering courses. Again, that graduate capstone course. So while this one is least customizable, this one, if you're interested in learning more about the hard sciences, or maybe are interested in learning how to work with biomedical devices at the nanoscale, this would be the concentration worth exploring for you. And finally, we have our complementary and integrative pharmacy concentration. This concentration is unique because it focuses on an alternative approach to medicine. It utilizes medicinal herbs, natural remedies, and ancient traditions to try to find new approaches to modern problems in the world of healthcare. Notice the elective hours. There are 13 credit hours available here, so therefore it's more customizable than many of the concentrations. You also have 6 credit hours that are specific to complementary and integrative pharmacy. And again, this is a degree that you will walk out with a portfolio of yourself because of that graduate capstone course. Throughout the MSPN degree program, there are a myriad of topics that are covered. Some of the ones are specific to nanotechnology, like nanoscale drug delivery system, nanomaterials in medicine, and nanoformulations. Others are more general science and laboratory specific skills, like risk management, scientific writing, and ethics within pharmaceuticals. Some of the areas of focus that we are most proud of are pharmacogenomics. That is just a way of talking about personalized medicine, which you'll learn more about in the program, but essentially, we're working on ways to make drugs work better for people on an individual basis because everybody is different and every approach to their healthcare should be different as well. But there are so many more topics that can be covered, and if you want to learn more about them, feel free to reach out to us in the admissions office or in the advising office after you start your application. I've already mentioned to you that the MSPN degree program is hosted by an interdisciplinary faculty, meaning our teachers come from all sorts of different backgrounds, departments, companies, what have you. And that is good for students because it allows them to network and be exposed to more perspectives and experiences of the people in the industries that they'll be working for. It's not uncommon at all for our students to be working through their coursework and wondering, what am I going to do after I'm done with this? And they ask their teachers that, and maybe they have more connections that they could help them find a job afterwards. Some of our faculty include, of course, our Taneja College of Pharmacy core faculty. We have participating pharmacy departments such as pharmacotherapeutics and clinical research and pharmacy practice. We also have some joint and adjunct faculty, graduate instructors, and some even volunteers that help out from around the community and even from other colleges. I mentioned earlier that our alumni from the MSPN degree program have a 100% placement rate, meaning everybody is moving on in either their professional or academic careers after getting the degree. You can look on the screen to see some of the careers that our alumni are in right now, such as proposal writer, toxicology, formulations research assistant, manuscript publishers, and some of our alumni end up going into academia, being academic instructors or educators. When students are exploring and considering the MSPN degree program, it's important to keep in mind what we talked about at the beginning of this presentation, that nanotechnology is everywhere and is revolutionizing the way that industries work. We've talked a lot about how it affects pharmacy in terms of drug discovery and delivery, but it's also changing fields like engineering, dentistry, biomedical sciences, and veterinary work. And now, as we progress into a more and more modern world with artificial intelligence, AI and nanotechnology are working hand in hand, one improving the other every single day. So it's important to note that this degree program isn't just going to make you a better pharmacist, it can make you a better scientist and set you up to be an innovator in whatever industry you decide to be in, because nanotechnology can improve all of them. We understand that when students are looking to expand their education, they're doing it to accomplish their goals, to improve the world around them, or to revolutionize the field that they're planning on going in. But it's also important to talk about the type of money the jobs can give you after getting an MSPN degree, which is why we have this slide to give you an example of some of the base pays that are available afterwards. You could be an associate scientist for around $75,000 a year, a formulations chemist for around $60,000 a year, or maybe a lab director for about $65,000. It's important to note that these are base pay salaries, and over time, whatever field you decide to be in, and if you stay in it, those numbers just go up. But the big picture thing to keep in mind here is when you graduate with a STEM degree, you are setting yourself up to be more financially stable than those who don't graduate with a STEM career. Now we'll kind of go over what we've talked about with the MSPN degree program so far before we get into the application requirements to get into it. Once again, we are very proud of our flexibility of our program, with it being online or on campus. But remember, nanomedicine is the specialization that is the online option. But we wanted students to have that option to do it online or on campus to give them, the experience that they want. But also, many of our students tend to be working or having other kinds of obligations, and they find that they're able to balance those out with the way that we structure our program. Once again, 32 credit hours for each one of the concentrations and courses. Again, this is designed to be efficient. We didn't want a lot of excess hours. We wanted it to be a degree program that students would be able to finish and not be overwhelmed with too many courses. And that's one of the things that we're proud of in terms of the MSPN program. You can start any semester. There's rolling admission, which means that you can be here in the fall, spring, or summer semester to start out at. And that's different from, say, the PharmD program, for example, that starts in the fall every single year. And again, we've talked about the flexible curriculum. Students are able to learn more about what they want to learn about in the form of picking their academic options as well as all those curriculums. And again, we have a lot of networking opportunities amongst the students from other disciplines. The pharmacy program, the interdisciplinary faculty, and all of our partnerships from USF Health with the neighboring companies. So, who should be applying to the MSPN degree program? Well, students do need a bachelor's degree to apply. It is not required, but it is highly recommended for that degree to be in either a science or engineering-based discipline. The reason being that the nanotechnology coursework is a hard science, and students will simply be more set up for success if they're coming into the program with that type of background. We are very proud to accept both domestic and international students. Some programs international students aren't eligible for. Take our pharmacy program, for example. So that leads to many applications coming from all over the world, and we are very proud of our diversity within the MSPN degree program. Like I've said, many students come to this degree looking for a gap year program before they go off to whatever professional school they would like to go to, like dentistry, medical school, pharmacy school. This sets them up for success and is a good way to give them more time to learn about a new discipline and also figure out which professional school they want to apply to. Likewise, sometimes we have people who are already in professional school or looking to get into professional school who are simply looking to enhance their applications. So they come to the MSPN program to boost their resume. And also we have students who come from different companies and programs who are looking to expand what they already know, even though they've already been working. Now let's get into all the things you need in order to apply. Our application is online, and there's a $30 application fee. In order to apply, you're going to need to collect all of your transcripts from all of the colleges and universities that you've attended. If necessary, the university may ask you to get an evaluation of your transcripts so that they can be translated for our system. If English isn't the first language that your country speaks, you will need to get an English language proficiency score like Duolingo sent to the university. You're also going to need a statement of purpose, which many students often have questions about. The statement of purpose is simply a statement telling us why you want to be in the program, who you are, the things you want to accomplish, why you're interested in healthcare, what you want to change about healthcare. It can be anything like that. All of those were just examples, but the statement of purpose is basically to tell us who you are and why you want to be here. Likewise, you're also going to need 2 letters of recommendation. We prefer those to be pretty recent and for one of them to be from a science instructor, like a professor, and if you happen to have work experience in a lab or some other science-related field, we would like to hear from your supervisor as well about you. And we want to let you know that the GRE is not required. We do have a small number of merit-based scholarships available to students who qualify, But very important things to keep in mind with these is that they are not fully funding, meaning these scholarships will not cover the full cost of the degree. Likewise, students who are admitted are sent the information about the scholarships, meaning you won't know anything about the scholarships until after you're admitted to the program. Now we'll talk about our concurrent degree program between our Doctorate of Pharmacy program and our Masters of Science in Pharmaceutical Nanotechnology program, which is a point we are extremely proud of at the Taneja College of Pharmacy because, again, students are not able to pursue this type of education anywhere else because the MSPN program is one of a kind. There's a couple of important things to keep in mind if the concurrent degree option interests you. Number one, students pursuing a pharmacy degree are actually not required to get a bachelor's degree. However, like we talked about, a bachelor's degree is a requirement in MSPN. Therefore, students need to have a bachelor's degree in order to be a concurrent degree seeking student in PharmD and MSPN. Another very important detail for international students considering a concurrent degree is that USF's Doctorate of Pharmacy program is only available to US residents, so students who are not US residents are not eligible to be in the concurrent program. Students who are interested in the concurrent degree program have two options for how they want to accomplish getting a PharmD and MSPN degree. The first option is to get a bachelor's degree, apply, and be accepted to pharmacy school, then take a semester of PharmD classes before applying to the MSPN program. The point is to allow students to get a better understanding of academic rigor required of the pharmacy program before adding more coursework for the MSPN courses. Students pursuing this route are strongly encouraged to take the nanomedicine specialization because, again, it is the most flexible in terms of when students do their coursework because it's available fully online, so it's easier to manage with PharmD coursework. Students in the concurrent degree program also tend to take their MSPN classes in the summertime when their PharmD courses are out of rotation. The second option is for students to do the entire MSPN program before even applying to pharmacy school, using MSPN as a gap year program. This route has actually been appealing to a number of students for a number of reasons. For one, students who aren't exactly sure what field of healthcare they're looking to be in may want more time to decide, but want to continue their education while they think about it. Like we talked about, nanotechnology is revolutionizing more than pharmacy. It's changing the way healthcare works across the board. So students who know they want to be in healthcare but aren't sure about what field can largely benefit from an MSPN degree because nanotechnology is almost certainly going to be a part of the field they end up in. Already having a graduate level degree in MSPN also makes students applying to pharmacy school or any other professional healthcare program a much stronger candidate. When students come to the Taneja College of Pharmacy looking to become pharmacists, we strongly encourage them to look into MSPN. Again, the knowledge of nanotechnology is a critical piece of our alumni's resumes and has helped them find success after they've finished school. The MSPN degree not only sets alumni apart in the hiring process for research facilities, hospitals, labs, and the like, it also helps students achieve more financial stability. Dr. Mohapatra says the data shows that pharmacy graduates from USF make between $30,000 and $40,000 more when they have the MSPN degree when compared to their competitors that only have the pharmacy degree. This next slide is to show you some of the shared coursework when pursuing a concurrent degree. This is simply to show you that the two programs have some courses that are interchangeable and count both for the PharmD and MSPN programs. This helps to lighten the load because, again, the concurrent degree path is a rigorous but fruitful one. I've mentioned some ways the MSPN program can help students network within the healthcare field. We are very proud of this next effort called the Pharmacy Industry Network, or PIN for short. The idea behind this initiative was to create even more connections between the students in the Taneja College of Pharmacy and members of the industry. Bridging the gap between the college and the careers is an effort taken very seriously by our faculty, including Dr. Mohapatra and Dean Sneed. PIN is meant to help students find careers, but we also try to have our alumni come back and present at seminars and other meetings to help inspire our current students and also increase those networking opportunities. It's an amazing chance for our current students to ask questions to the people who have the perspective of currently working in the field. I want to take time to tell you that we also have a number of graduate certificates in pharmaceutical nanotechnology available as well. These are meant to give our students even more options in expanding their education. Notice that they require about half the number of credit hours as the master's degree program. Many students who are unsure about if they want to do an entire grad program or want to get some experience in this field without going through the whole degree find these options appealing. Additionally, some of our students in the MSPN program will choose a concentration that appeals most to them, but add a graduate certificate to get some more exposure to topics in one of the other concentration areas. For example, you could choose D4M because you really want to do original research, but then add the pharmacy entrepreneurship, leadership, and management certificate to get some exposure to the business side of pharmacy. Like I said, these programs are designed so that you can learn what you want to learn about. Also note, the coursework for the graduate certificates is the same as MSPN. In other words, grad students and certification students are in the same classes. Certificate students are just in less of them. Once admitted and enrolled in classes in the MSPN program, students have a number of different resources available to them. You can see them on your screen, including student health services, veteran services, disability services, and more. We're also happy to say that we have 2 student organizations that you can join. They are a great group of people to connect with in the program and add some camaraderie to your experience, and again, have a bigger network on the way out. Being in and perhaps even having a leadership role in a student organization is also a great way to boost your resume. Thank you so much for watching this information presentation. If you have any questions about the program, please don't hesitate to reach out to the email you see on this slide. Also, be sure to follow us on our social media accounts. There, you can get a better idea of the other things that we're working on in the Taneja College of Pharmacy, as well as hear about upcoming events, talks, seminars, and see what some of our students who are already in the program are up to. We cannot wait to hear from you and help guide you along your academic journey. Thanks again, and go Bulls.